In this video, we will discuss regarding the second part of the question paper. The 23rd question is, Nyctalopia and Bitot spot are due to deficiency of, options are vitamin A, vitamin C, vitamin D and vitamin E. The correct answer is option A, vitamin A. Next question. 1 pint of 10% dextrose yields how much of calories? Options are 100, 200, 300, 400. The correct answer is option B, 200. Next question. The thick collection of nerve fibers that connect the two hemispheres of the brain is called. Options are corpus callosum, hypothalamus, pons, brainstem. The correct answer is option A, corpus callosum. Next question. Caudal airway is a, options are oropharyngeal airway, nasopharyngeal airway, laryngeal airway, tracheal airway. The correct answer is option A, oropharyngeal airway. Next question. All of the following are complications of immobility except, options are pneumonia, deep vein thrombosis, pressure sore, hepatic failure. The correct answer is option D, hepatic failure. Next question. Which of the following represent lead 3 of electrocardiography? Options are right leg to right arm, left leg to left arm, right leg to left arm, left leg to right arm. The correct answer is option B, that is left leg to left arm. Next question. In Trendelenburg position, options are the foot end of the bed is elevated, the head end of the bed is elevated, patient is put in decubitus position, patient is put in prone position. The correct answer is option A, the foot end of the bed is elevated. Question number 30. Gastric lavage should not be done in, options are antipsychotic drug poisoning, corrosive poisoning, organophosphorus poisoning, organochlorine poisoning. The correct answer is option B, that is corrosive poisoning. Next question. Which of the following clinical nursing practices is recommended as most important to healthcare and nursing professionals today? Options are primary care nursing, community-based nursing, authoritative nursing, evidence-based practice. The correct answer is option D, evidence-based practice. Next question. The oral clinical thermometer records a temperature of 102 degree Fahrenheit in a patient scheduled for surgery, but the patient is febrile to touch. The first thing to be done by the recording nurse is to inform in charge nurse, inform the doctor, validate the findings, document the findings. The correct answer is option C, validate the findings. Next question. Which route one uses to identify hypothermia in a newborn? Options are oral, rectal, surface probe. The correct answer is option C, rectal. Next question. A non-admitted cardiac patient develops dyspnea. What should attending nurse do first before other activity? Options are remove pillow from under the head, keep the patient in left side up position, elevate the foot end of the bed, keep the patient in propped up position. The correct answer is option D. Keep the patient in propped up position. Next question. In the critical care pain observation tool, which facial expression has been given the score of 2? Options are relaxed, neutral, tense, grimacing, shouting. The correct answer is option C, grimacing. Question number 36. Which method of documentation uses the categories data, action, and response to facilitate nurses' daily charting? Options are narrative notes, focus charting, case management model, minimum data set. The correct answer is option B, focus charting. Question number 37. When implementing the plan of care for a patient receiving intravenous therapy, which nursing practice would be most appropriate? Options are changing the IV catheter entry site daily, changing the tubings every 8 hours, increasing the rate to catch up if the correct amount has not been infused at the end of the shift, monitoring the flow rate once every hour. The correct answer is option D, that is monitoring the flow rate once every hour. Question number 38. While administering a blood transfusion, the ideal nursing care recommended to identify a blood transfusion reaction is. Options are inspecting 15 minutes after the infusion is started, inspecting at the end of transfusion, inspecting once in every 30 minutes. The correct answer is option C, that is inspecting once in every 30 minutes. Next question. When caring for a patient with chronic lung disease on oxygen therapy by nasal cannula, the most important check that is expected of the nurse is. Options are the oxygen must be humidified, the rate will be 2 liters per minute or less, periodic sampling of arterial blood for ABG, the rate will be 6 liters per minute or more. The correct answer is option B, that is the rate will be 2 liters per minute or less. Question number 40. Which nursing action is inappropriate when performing oropharyngeal suctioning on a patient? Options are using sterile technique, applying suction as the catheter is being introduced, flushing the catheter with saline between catheter insertion, limiting suction to 15 seconds intervals at one time. The correct answer is option B, that is applying suction as a catheter is being introduced. Next question. Dilated pupil could result from. Options are structural lesions in the pons, morphine poisoning, pilocarpine eye drops instillation, brain death. The correct answer is option D, brain death. Question number 42. Rest is needed in patients with coronary artery disease to correct arrhythmia, reduce oxygen requirement of the body, reduce the size of the heart, reduce the tendency for insomnia. The correct answer is option B, that is reduce oxygen requirement of the body. Question number 43. Myasthenia gravis is a disease of. Options are neuromuscular junction, anterior horn cell, skeletal muscle, spinal cord. The correct answer is option A, that is neuromuscular junction. Question number 44. Parkinson's disease is characterized by the following except uniform spasticity, postural instability, tremor, bradykinesia. The correct answer is option A, that is uniform spasticity. Question number 45. One of the following drugs cannot be used in hypertension management, that is options nifedipine, dopamine, propranolol, reserpine. The correct answer is option B, dopamine. Question number 46. The typical ECG pattern in the appropriate alerts of acute myocardial infarction. The options are ST depression and T wave inversion, Option B, ST segment elevation. Option C, deep T wave inversion. Option D, right bundle branch block pattern. The correct answer is option B, that is ST segment elevation. Next question. One of the following drugs is used to lower blood cholesterol. Options are diltiazem, propranolol, furosemide, atorvastatin. The correct answer is option D, that is atorvastatin. Next question. One of the following is an antiplatelet drug. Options are digoxin, streptokinase, aspirin, dobutamine. Correct answer is option C, that is aspirin. Question number 49. The drug that is used to treat a cyanotic spell in a child is. Options are morphine, pethidine, diazepam, haloperidol. The correct answer is option A, morphine. Next question. The supportive cells of the nervous system are. Options are T cell, stem cell, glial cell, astrocytes. The correct answer is option C, that is glial cell. Question number 51. A 35-year-old smoker with gangrene toe most probably suffer from. Options are thromboangiitis obliterans, Raynaud's disease, atherosclerosis, arteriovenous fistula. The correct answer is option A, that is thromboangiitis obliterans. Next question. Nursing activities shown to potentially increase intracranial pressure include. Options are raising the head of the bed to 30 degree, applying therapeutic touch, endotracheal suctioning, speaking softly. The correct answer is option C, that is endotracheal suctioning. Next question. The treatment of mitral stenosis is. Options are balloon valvotomy, PTCA, bypass surgery, and angiogram. The correct answer is option A, that is balloon valvotomy. Next question. One of the following is a new test used in acute chest pain. Options are SGOT estimation, troponin T or I estimation, blood cholesterol estimation, LDH estimation. The correct answer is option B, that is troponin T or 1 estimation. Next question. The nurse should expect a patient who has chronic renal failure to be given erythropoietin epogen to. Options are elevate the WBC count, enhance the maturation of thrombocyte, increase the production of platelet, stimulate the synthesis of red blood cells. The correct option is option D, that is stimulate the synthesis of red blood cells. Next question. When teaching the caregivers of a patient who has dementia of the Alzheimer type, a nurse should stress the importance of. Options are increased stimuli, a predictable environment, restricted activities, independent decision making. The correct answer is option B, that is a predictable environment. Next question. Which of the following blood value on the laboratory report should a nurse expect when assessing a patient who has emphysema? Options are PCO2 52, pH 7.48, PO2 94, HCO3 21. The correct answer is option A, that is PCO2 52. Next question. Which of the following condition would a nurse recognize as contributing to the development of respiratory acidosis? Options are COPD, hyperventilation, diarrhea, achalasia. The correct answer is option A, that is COPD. Next question. Which of the following outcome observed by the nurse during the drain cycle of peritoneal dialysis should be reported immediately to the physician? Options are clear yellow output, cloudy output, patient complaint of slight cramping, a drain output of 50 cc less than instilled. The correct answer is option B, that is cloudy output. Next question. Which of the following foods should be removed from the dietary tray of a patient who has hepatic encephalopathy? Options are idli, drumstick leaf, fresh fruit, eggs. The answer is option D, eggs. Next question. Which of the following findings would a nurse identify as indicative of septic shock in a patient? Options are bradycardia, elevated JVP, cool clammy skin, S3 gallop. The correct answer is option C, that is cool clammy skin. Next question. The nurse should instruct a patient who is to receive digoxin or lanoxin to report development of which of the following side effects? Options are ringing in the ears, loss of appetite, signs of bruising, sensitivity to sunlight. The correct answer is option B, that is loss of appetite. Next question. Enteric fever is transmitted by options are inhalation, ingestion, inoculation, insects. The correct answer is option C, that is inoculation. Next question. Nursing care for a patient who has polycythemia vera would focus on preventing. Options are dysarthemia, hypotension, thrombosis, decubitus ulcer. The correct answer is option C, thrombosis. Question number 65. The length of the spinal cord in an adult male is? Options are 18, 45, 50, 36. The correct answer is option B, 45. Next question. When caring for a patient who is on a mechanical ventilator, the nurse should monitor the patient for which of the following complication? Options are flail chest, pleural effusion, pneumothorax, pulmonary embolus. The correct answer is option C, that is pneumothorax. Next question. Broca's area controls. The options are sensory function, speech, emotions, motor functions. The correct answer is option B, that is speech. Next question. Who invented the blood grouping as A, B and O? Options are Landsteiner, John Gibbon, William Harvey, Robert Bocher. The correct answer is option A, Steiner. Next question. Which of the following vitamin is soluble in water? Options are A, E, C, D. The correct answer is option C, that is vitamin C. Question number 70. How many lobes are present in right lung? The options are 7, 2, 3, 9. The correct answer is option C, that is 3. Question number 71. Which plane divides the brain into unequal right and left portion? Options are frontal plane, transverse plane, mid-sagittal plane, parasagittal plane. The correct answer is option D, that is parasagittal plane. Next question. Which channels are open during depolarization in metabolism? The options are K plus, Na plus, Mg plus, Ca plus. The correct answer is B, that is sodium. Question number 73. What is the outermost layer of the heart called? Options are endocardium, epicardium, myocardium, pericardium. The correct answer is option B, that is epicardium. Next question. Cholesterol is important in the human body for options are angiogenesis, cell membrane structure, enzyme synthesis, osteogenesis. The correct answer is option B, that is cell membrane structure. Next question. In the PQRS wave in ECG, P wave represents options are atrial depolarization, atrial repolarization, ventricular depolarization, ventricular repolarization. The correct answer is option A, that is atrial depolarization. Next question. To calculate cardiac output, heart rate is multiplied with the options are stroke volume, systemic arterial pressure, pulmonary arterial pressure, circulatory volume. The correct answer is option A, that is stroke volume. Next question. In which organ are the coupler cells present? Options are brain, heart, liver, pancreas. The correct answer is option C, that is liver. Question number 78. Gonads means options are salivary gland, sebaceous glands, sweat glands, testes and ovaries. The correct answer is option number D, that is testes and ovaries. Question number 79. In protein classification, class A proteins are options animal protein, vegetable protein, oil protein, milk protein. The correct answer is option A, that is animal protein. Question number 80. What is the scientific name of vitamin B6? Options are biotin, pyridoxine, nicotinic acid and thiamine. The correct answer is option B, that is pyridoxine. So we have discussed 80 questions in both the video part 1 and part 2. So we will see in next video with any other institutions previous staff nurse questions. Please subscribe and support. Thank you.